have to thank and commend our development partners. They've really been truthful and kind to us as a country in coming to efforts to improve a lot of several areas of our public health system, more so in areas of HIV, vaccine, and maternal mortality rate, and even more now with nutrition. We have problem with malnutrition in children, even in pregnant women, and several other areas. We appreciate these significant funding are coming to the system to support us, but then we're seeing gradual decline, and at some point, a lot of this funding will sunset. It's incumbent on us as a country to find a way for this program to be sustained into the future. And we have a President Bola Ahmed Tinubu, that believes strongly that every nation is a call to harnessing our biggest wealth. And that biggest wealth is our human capital. And we also have this President Bola Ahmed Tinubu that is so committed to advancing healthcare delivery to Nigerians, in amongst the other several things he's doing across all the sectors in the country. We'll be getting more information to the public as we go along in the next succeeding months that would create significant domestic resource mobilization to fund various sectors of our healthcare system, from the primary, secondary, and tertiary care level, and even fund research. The funding that we've identified would bring trillions of money into the health sector year over year in a sustainable manner. President Bola Ahmed Tinubu believes in sustainability, and it's mandated us to look for ways where a lot of this help we're getting now from various of our development partners will be able to now provide domestic resource funding to sustain them into the future. And we're hoping as we work along with this plan to mobilize government funding into our healthcare system. As we move along, we hope in the next several months we'll be at the point where this will be launched. It's not only about HIV alone, it's all about public health. There's significant hyper-fragmentation in our system now. We have several development partners running their programs in parallel. Then we have problem with hyper-fragmentation. HIV program is just one of the various programs that's been so hyper-fragmented. And that's why we've come with our SWAP sector-wide approach programming. That SWAP program that is kicked off, we're seeing good uptake with the SWAP program as we're doing the initial analysis. The president launched this SWAP program several months ago. And the SWAP program, the sector-wide approach program, is designed to coordinate and align all this funding so that we can begin to direct those fundings where those fundings are needed and where those programs are. We can begin to align all these programs so that we can now eliminate this hyper-fragmentation. Luckily, a lot of our development partners have signed up to it, and there are various areas we're doing this. We can either pool our resources together and now do direct allocation to areas of need. Even the partners that are not willing to co-pool with us, we're working with them to align their program so that we can eliminate this duplication that we currently have. And I'm happy to say our development partners have seen the reason for this, and they've shown interest, they've embraced it. And as we move along with our sector-wide program as well, the pooling of funds from the partners together with our own basic care provision fund, we now have more money to direct to our primary healthcare centers where they have more money to improve their infrastructures, hire healthcare workers, and be able to have more funding to buy more commodities. So a huge part of the pool fund, together with our basic healthcare provision funding, will go about 45% or so of it will go to the primary care center, the PACs, and then we also have the gateway, the funds that will go to our National Health Insurance Agency, where we begin to have more people being covered. And the third part is our emergency medical services. So, and as we do this, there will be more improvement in the number of people that we're able to reach for vaccination, for nutritional supplement, for maternal care, and our pediatric care in all aspects. A common goal here is to improve healthcare delivery and healthcare services to Nigerians, to citizens. And with this, we'll be on the way to our plan to universal healthcare coverage. Absolutely. The plan is now to start domestic manufacturing of this antiretroviral medication in Nigeria. By next year, we're talking to several of our big pharma that have shown interest. But then, if they're showing interest, we have to create the market space for them. They're making frontal investment, but they have to be sure that they do this investment, they can get return on their investment, where they know they have substantial sale to the government. And that's part of the executive order. We put in the executive order a component that's market shaping. Market shaping means that we will find a way to pool, aggregate together this procurement, the drugs that need to be procured. HIV is one of antiretroviral medication is one of them. But there are also various areas, commodities, malaria, bed nets, even RDT, rapid diagnostic test kits, and a whole lot of things. And that's the entire area of this is what unlocking an healthcare value chain aim to address. We would move a lot of this, domesticate a lot of the manufacturing of this. And we've seen a lot of traction now. A company would launch its own domestic production of test kits, which is also pre-qualified by World Health Organization. We're doing it via transfer of technology, and we're encouraging several of our pharmaceutical companies to also look at that option, to reach out to other international pharmaceutical companies to do technology transfer. And we're also working with World Health Organization to expedite and fast track the processes of agent pre-qualification to several of these commodities that we're using. And as you also see, we also, as part of our unlocking of value chain, we also want to begin to domesticate the manufacturing of some of the vaccines that we're currently using. And as we move along, we can now bring in more, improve our manufacturing capacity. And the whole essence of doing this is to now begin to create more jobs for our young, able male and female citizens who are educated and want to work, want to have decent paying jobs. If we don't expand our manufacturing base, we will lose the opportunity to create jobs for the young men and women. And our National Regulatory Agency as well, NAFDAC, has been very proactive in helping to coordinate where all the building blocks and areas of obstacles in a way that we now begin to use our NRA, NAFDAC, to certify these drugs. And we just don't want to produce enough for our country. We also want to produce for sub-Saharan Africa, so that we can expand the market space for these manufacturers, so they can begin to also improve on their capacity to produce other drugs. We have to provide the enabling environment. The President has given us all the support at the Ministry of Health, and we're working to change the environment. And I'll be happy to let you know that a lot of the manufacturers are embracing this. They want it, and the executive order is one of the several things that we're doing to unleash our manufacturing capabilities in the country. I've met with several Nigerians there. I've walked around. I'm happy to be part of to be here. And my own coming here is also to get to reinvigorate our AIDS response strategies, so that we can also be part of the Committee of Nations that will end HIV/AIDS by the year 2030. We're making progress on a 95 target, but an area that's still of major bothersome to us is the areas of the prevention of mother to child transmission of HIV and our pediatrics antiretroviral coverage rate. We have our numbers are not good, but then we've started even before coming here. We put strategies in place. Just 2 weeks ago, I launched the PMTCT and Pediatric Antiretroviral Coverage Acceleration Committee, which I'm personally chairing that committee. That committee has the sole function to increase the percentage of prevention of maternal to child transmission of HIV, and also to increase antiretroviral usage in a pediatric population, children under 14 years. So we've also talked about, I also met with the Executive Director of UNAIDS, Mrs. Winnie, today, to also put plans in place on how UNAIDS can also continue to work with us. They've been working with us robustly on this area. We also identify other areas where we can do advocacy work with the wives of our governors, with spouses of our governors. We're going to be engaging them to start doing a lot of advocacy at a subnational level, as well as other things we're going to be doing to tackle these a low rate of prevention to maternal child transmission of HIV. I believe in the next several months ahead, once all these programs that we've put in place are working, we'll begin to see an uptick in the prevention percentages of that we call compared to what we have now. And also beyond that, there are so other areas that we're also working on to reduce our HIV burden in the country. But at this point, we're not doing badly, but there's a lot of scope for improvement, and that's what we're challenging ourselves. And I'm happy with a lot of conversation and discussion that I've had here with several of our bilateral partners and several of our implementing partners. Everybody is in sync to getting us to ending HIV by the year 2030.